how are you? My name's Frances Seaslake and I'll be the nurse interviewing you today. So take a seat and lovely to meet you. Thanks for coming along today and thank you for applying to our health service hospital for a graduate nurse position. So that's terrific. And as you'd probably expect, we're going to ask you a few questions. So if you can just answer them as best as you can. Try not to be too nervous. We won't bite. We just want to get to know you a little bit better and to make sure that you're a good fit for us and that you'll be successful in our graduate nurse program here. So if I can just begin, would you mind telling us a little bit more about yourself and some of the qualities that you think you will bring to your nursing as a graduate nurse?
Thank you. My name is Manoj Kumar. A little bit about myself is that I'm a big fan of traveling. I love to travel, and all over Victoria, I have traveled to so many locations and planning to do an Australia-wide trip as well. So, the qualities that I would bring as a graduate nurse to your organization is that I'm a good team player. I have excellent communication skill and a strong attention to details when it comes to caring for my patient. The other key factors that I believe I have is that I'm compassionate towards my patient, I am empathetic towards them, and I respect them for their culture, their values, and their beliefs.
Okay, thank you. May I also ask you why you want to work at our organisation? What was it that made you apply to our hospital?
Langton Health is a major large tertiary organization and it provides tertiary care and with its major campuses in Moorabbin and Berwick. This hospital has been providing its services to Victorians for over 150 years. And the factor that I applied at your organization are because of the services that Langton Health provides. It provides acute medical and surgical services. It provides mental health services. It provides emergency and critical care. It provides palliative care and rehabilitation services to its patients. So these are some of the areas I want to work in as a nurse. The other factor which I believe really derived me towards Langton Health is that because it is known as the center of excellence for its clinical trials and its research in cardiovascular and infectious diseases. Also, Langton Health also have vast majority of collaborative services and partners which they help deliver the quality techniques and treatment, teaching to the new students being as one of a teaching hospital as well. The other one of the major health services which work in collaboration with the Langton Health is Monash Health, which is also known for its studies and research in the medical sector. So these are some of the key factors which really derived me to work at Langton Health, and am going to be really proud to be a part of such a great healthcare service.
Okay, thank you. Um, can I ask you what your particular interests are and what your, sorry about that, that's my phone, what your particular nursing interests are and why you're interested in those areas?
I believe triage and emergency care services are the areas I would like is one of the area I would like to work in, as I would love working in a fast-paced environment given the injuries and the amount of patients come every day in triage and emergency services. The other factor is that triage and emergency services are the first area to come in contact with the people who are in desperate need of medical help. So I want to be someone who's compassionate and who is empathetic towards their situation and help them with the necessary need of medical treatment. The other area I believe I would love to work in is mental health, as it is one of the undermined area of nursing. And from my past experience and because of some personal contact with a family member, the area of mental health is still treated as a stigma. So people with mental health do not come forward to take necessary actions towards their health. So I want to bring a positive change as much as I can towards the society and helping individuals who are in desperate need of mental health services. So these are the two areas I would love to work in as a nurse.
Fantastic. Just a couple more. The other thing I'll be interested in knowing is a little bit more around how you deal with conflict, or if you've ever been in a conflict situation, that might be with a colleague or even a manager. How have you dealt with that situation? What's the sort of strategies that you use to manage conflict?
Yes, there has been instances when I was in a conflict with the parents in my pediatric placement. So the strategies that I used were staying calm, listening actively to the problems they are facing, and trying to give them a response about as much information as I had about the situation. So what happened was the patient, who was a 10-year-old boy who was waiting on surgery and was fasting from last 10 hours and was crying for food, although the IV saline was running. So the parents were really frustrated and agitated about the boy crying, about the patient crying and asking for help. So when I answered the call bell, when I entered the room, so the parents were really frustrated and were almost shouting at me. I just stayed calm at the position and I tried to listen to the problem that they were facing actively at the moment. So I stayed calm, listened to them, and tried to answer the as much as I could answer on the spot. So because I didn't had any information about that patient, he was a new admission in the morning, and he was waiting for surgery, and it's been almost 10 hours. So I went in and asked my nurse in charge about the patient. She raised the issue and urgently contacted the doctor about the situation. And the doctor agreed to had the patient in the theater within the next 1 hour. So I went in and explained everything to the parents and the patient as well, and they were relieved and a little bit happy about the information that I was providing to them. They asked us for the complaint form, and we provided that happily to the parents. And the nurse in charge also came into the room, reassured the parents, and felt sorry for any inconvenience that they had faced in the hospital during their stay. So I believe that day, being actively listening to the parents and staying calm on my feet, and by answering their questions, their problems appropriately, really helped me on that day.
Okay, thank you very much. And finally, I'd like to ask you a clinical question, if I may. So, you're working on a general medical ward, and you have 5 patients under your care. 4 of those are in a ward situation, and one of them is actually being nursed in a private room with some infection control measures in place. You've just left that room, washed your hands and all of the usual things, and you actually go in to help a 79-year-old gentleman transfer from bed to chair. He has a history of AMI and he's complaining to you now. He's got chest pain, feels short of breath, and actually, as you're about to transfer him, collapses on the floor. Can you please talk us through your immediate response and your immediate clinical actions that you will take in the event that this occurred to you or during your shift?
So if a patient collapses while I'm transferring him from chair to the bed and he collapses on the floor, I would follow the doctor's ABCD approach. I would check for any dangers around the patient, either it's electrical wires or if there's a chair near the head of the patient. So I would remove any danger or clutter from around the patient. After that, I will check for response from my patient. If there's no response, I will send for help by pressing the emergency buzzer. After that, I will check if the patient's airway is patent or is there something lodged in the airway. After that, I will check for the rise and fall of the chest to check for breathing. If the patient is not breathing, I would start compressions and the rate would be 100 to 120 per minute. And I will be waiting for the med team to arrive so they can uh, place the pads on the patient and check for the rhythm and defibrillate if needed. And after that, the team can take over, and I will be providing a handover about the patient to the med team, so they know about any drug allergies or allergies to any other medications or any past history which is relevant with the patient. So this will be my immediate response towards the patient if he complains of chest pain or collapse in front of me in a clinical healthcare setting.
Okay, thank you very much, and thanks for coming in. And again, lovely to meet you, and all the best. We will be in touch within the next week, and then we'll be able to let you know how it all went. Okay, lovely. Thanks very much.
Thank you.